All right, this is the second video for chapter 20. We're going to get into more of the nitty-gritty of benefits and providing benefits for employees. So in planning and designing benefits, we have to think about our organizational strategy and our compensation strategy as well. So our organization strategy might be to hire the very best. We might have a compensation strategy where we are, ahead of our competitors in terms of pay. So if that's the way we're thinking about benefits, then we might want to find out what are our competitors doing, and then how can we kind of outshine our competitors in terms of the benefits that employees want and that we can provide them. We have to set goals and objectives. And these could be like attracting or retaining employees with our benefits. It could be providing equity through the kinds of benefits that we offer and how much the employer will pay towards some of those benefits. We could also have cost targets where we want to provide, for example, health insurance that doesn't cost more than this. So we have to figure out what kinds of plans can we offer at that cost level, and then how much can the employer versus the employee pay for that insurance, for example. We want to consider our workforce demographics and preferences in choosing benefits. This is where employee surveys can be very helpful. For example, if we have a lot of younger employees, we might want to consider educational benefits like tuition reimbursement or helping people pay off their student loans. We might want to think about retirement, but we might have to explain to our employees a little bit more why they would want to invest in the retirement system and why they might want to match whatever the employer is willing to put into their retirement accounts. If we have older employees, their retirement will be very important. And we might even need to create some rules around how much people can put toward their retirement that could be different for different ages, because there may be people who are a little bit behind on their retirement savings. We may also have to provide more insurance, especially for employees who aren't yet eligible for Medicare at the age of 65. We might have to consider what kind of health insurance we provide, but then we also might have to think about how do we contain the cost for that health insurance as well. We need to manage the total cost first. So what is the total cost of compensation in our compensation system before we start thinking about benefits? And we want to think about benefits not as individual benefits, but as a mix of benefits that we're providing employees. That's the way to think about costs when we think about benefits. Even though sometimes you might be making decisions individually, you should have some idea as a package what you're going to provide for benefits for your employees. So in selecting benefits, we have to think about what's required, what's customary in terms of our industry, but it could also be our locale. If we're in New York City, for example, there may be benefits that people often get that people don't necessarily get in Kansas, for example. And then we also want to find out what are our competitors doing and how do we differentiate ourselves in terms of benefits from our competitors. We want to benchmark our competitors. We need to find out one, what their practice is, so what kinds of benefits they usually provide, and also at what level. So if they have health insurance, for example, do they provide different kinds of plans? What is their top plan? What is their lowest plan? And then we need to find out the cost if we can, where that's possible. And in terms of cost, how much is the benefit actually costing? How much is the employer providing? And then how much are employees paying for these to get a sense of what our competitors are providing, but also so we can figure out if they're only providing so much money for this benefit, could we increase the employer pay for this benefit? And, that is the way we compete with our competitors. We want to measure our employee preferences through surveys. We also may need to segment markets of our employees to find out what their preferences are. This can also help us create benefits packages that are more aligned with different kinds of employee preferences. So if we have different markets, we might have a package where more of the money goes to that tuition reimbursement or paying back student loans and a little bit toward retirement for our younger employees. But maybe for our older employees who are getting near retirement, we might have more of that money in retirement, in the retirement plan, and also in insurance. And then beware of overlap and dual earner duplication. So where you have employees either who are married couples, for example, or partners, depending on who's qualified for your insurance or for your benefits plan, sorry. If you have two of them working in your company, they may overlap. You may not need to provide double, one set of benefits for each employee. You'll have to think about how you want to do that. You could also have overlap. This happens a lot in Manhattan, for example, because we're near Fort Riley. A lot of employees here are related to the military, like their spouses in the military and they're working on campus. In that case, they often don't need the health insurance that the university provides. So we have to think about that overlap. But also, what do you do for those people? If they don't need health insurance, is there something else they might want, like more money in the retirement plan that we could provide them instead? So we have to think about who's going to receive the benefits as well when we think about our benefits packages. We want to think about equity versus differentiated packages for different groups of people. So executives often have better benefits packages than most other employees. They have what we call perks a lot of times, things like having the company car or a company jet available to them. Salespeople sometimes have different packages of benefits because they might be working on commission. So we might have to think about how their base pay versus their commission and how that might affect their benefits. And then our part-time employees. In a lot of workplaces, part-time employees aren't eligible for most benefits, but maybe there are some that we could provide and that could help us compete in the industry for some of these employees. Some benefits are required to be offered to most employees, and most employees have to take them on. For example, health insurance by law. So there's a lot of benefits where you can't provide like executives the benefit, but other employees never get that benefit. So that's where you have to know the law, the federal and state laws around those benefits. There can also be eligibility questions. For example, with health insurance, do we want to include dependents on that and how much are they going to cost? Domestic partners, which aren't legally married spouses, do we want to include them on our plans? How about people who are retiring from our company? Do we want to allow them to have access to some of these benefits, especially, for example, if they're retiring before they're eligible for Medicare? Do we want to provide health insurance for them potentially? Survivors. So if someone dies while they're working for a company, do we want to provide their survivors with some of these benefits? And then leave status, which could include people who are on military leave. There are laws around what benefits you still have to provide them. You could have people who are on family medical leave, in which case you have to provide benefits for them. But what levels and how long they're gone may be dependent on what kinds of benefits we're talking about, required versus discretionary. And then for some, like health insurance and retirement plans, there may be waiting periods or vesting periods. Waiting periods for health insurance. I know when I started at the university, I think it's a 30-day waiting period, so you don't have insurance until that 30 days. That prevents people earning employment at the university or getting employment at the university just to get the health insurance, using the health insurance and then leaving that employment. And then vesting is really common in retirement plans. It can be several years until you're fully vested in the plan. When you're fully vested, you can take the employer's contributions to your retirement plan on top of your own. If you're not vested, if you leave before you're vested in the system, you may be able to take only part of your employer's contributions, depending on how the vesting was done, if it's like a graded vesting, or like in my plan, I'm only vested at 5 years. If I leave before 5 years, I don't get any of my employer's contributions. Cafeteria plans are most common. This is where you provide flexible plans, pre-tax plans for employees, and then they get to choose what benefits they want. There are different kinds of plan types. There can be the mix and match where you have different kinds of benefits that they can choose from. You might have so many points or so many dollars that they can spend on those benefits and they can mix and match with what they want. You could have modular where you provide groups of benefits and then you have people choose which group is best for them. You could have core plus options. This is the way that the university does it, where you have core benefits that everyone's eligible for, like health insurance and retirement plans. And then there's some other optional insurance or optional services that they could buy into. So for example, disability insurance, because Kansas doesn't require it, that would be an optional benefit. And then you can also have pre-tax flexible spending accounts where people can put money into these flexible spending accounts to use it for healthcare expenses that are allowed by federal law. Or you could have premium only plans or POP plans where people have money and they can use that on their vision, dental, and prescription insurance. And then managing benefit costs, this is a huge part of what HR does, working with management and also usually third-party providers. You have to think about how you're going to manage costs because some of these benefits, like health insurance, are going up faster than inflation. So we can do things like change or reduce our plans. So we can have plan designs like We can change the kind of health insurance we provide. Are we going to be in an HMO? Are we going to have a preferred provider plan? What kinds of limits are we going to put on our health plan? That sort of thing. You could also have time off policy structures where when people take time off, they may or may not be eligible for the full benefits, depending on what the benefit is. For health insurance, a lot of managing the benefit costs is cost sharing. So things like having a premium where people have to pay a certain amount, especially if they go out of network, for different kinds of things. So, like, for example, you might be able to not pay anything for an annual exam, but there might be a premium if you need an MRI or if you need allergy testing or something like that. You can also have deductibles where employees pay so much up until the insurance starts kicking in. So on a high deductible plan, for example, you might have, I think I'm on a high deductible plan that's something like $5,000. I have to spend $5,000 and then the insurance kicks in and starts paying for my health care. You can have copays where employees pay to visit doctors and specialists, and those copays can be different for different kinds of doctors and specialists. It's really common to have like a $25 or $30 copay to go see a doctor. I went to physical therapy a couple years ago, and it was $50 copay for every visit. So that's pretty common. And then you can also have not in health insurance, but when we talk about retirement plans, you can have 401k matching, and you can have different matches for different kinds of employees, but also for different at different levels. So if, for example, at the university, staff have one kind of matching amount, and then faculty have a different kind of matching amount. And you can change those matching amounts to save money. So you could reduce the employer matching if you needed to save money. And then you want to think about administrative efficiency. Can you provide alternative funding? Could you do third-party programs that can save you money instead of, for example, providing your own health insurance? Could you find a third-party program that can provide it for you for cheaper? And then a lot of employers, especially bigger employers, ask for competitive bids for different kinds of benefits that they provide. And that way, then they can change their provider if a competitor can um, provide that benefit for a cheaper price than their current provider can. So managing health costs, as I said, is a big deal. We can do high deductible plans. We can have savings accounts like FSAs, HSAs. Another big thing that a lot of employers do is provide wellness programs. This could be things like paying for gym memberships. It could be providing healthcare, like health checks. It could be providing a gym on site. And the idea with wellness programs is that you're preventing a lot of problems later that should save you in health insurance costs in the future. You can do a utilization review to see how your benefits are being used, especially with healthcare. There could be different kinds of healthcare or different parts of the plan that are being used at different rates, and that might help you determine what you need to keep and what you can maybe get rid of because your employees aren't using it very much. And then for high cost cases, for people, for example, who might have a chronic illness where it costs a lot more money than other employees, there may be case management that you can do. There are going to be HIPAA laws involved here, but with case management, then you can make sure that you're providing insurance, for example, or health, or you're providing some way of controlling those healthcare costs while still providing that care for those employees. And then I also included this figure from the book just to show you how much faster health benefits are costing employers compared to like inflation. And you can see how much workers are also contributing more and more to those costs. So this is just going to be a problem going into the future. And in fact, I think it might be getting faster in the future simply because there are so many different entities involved with healthcare in the US, and all of them are often charging way more than inflation in price increases per year. So this is a continuing battle for a lot of employers. For retirement plans, there's a lot of trends. As I said, we're going from a defined benefit plan where employees knew exactly how much they were going to get at retirement for their monthly checks to a defined cost plan where employees know exactly how much they're going to be putting in, but it's up to them to invest that money. it's not, they don't know exactly how much they'll get at retirement, but the hope is that you do a really good job so that you can try to maximize the amount that you'll get when you retire. You can have vesting periods where people have to wait to be able to get the employer contribution from their retirement plan. There is a lot more portability. So a lot of people, I've done this in my own jobs, they can use their 401k or their 403b, for example, and when they leave the employer, they can take that money with them, including if they're vested the employer's contribution, and then they can go invest it in another account if they'd like. There's also ERISA provides some guidelines around long-term liability and employer solvency risks, so that a lot of there's some insurance essentially for these retirement plans, which can help employers as well and employees to feel secure in putting their money into these retirement plans. We do have some unintended consequences, though, when we think about benefits, and it's something we need to keep in mind when we're choosing what benefits or how we're going to design the packages for our employees. We can have internal inequality or inequity where we have haves and have-nots. This is very prominent when you are in a workplace. Like I used to work in retail. Full-time employees would have access to benefits, but part-time employees wouldn't. And it was very well known that managers were trying to keep people in part-time positions so they wouldn't be eligible for benefits. With that internal inequity, it can be hard to keep employees, and they can grow resentful of their employer. You can have overtime and part-time incentives, where people are working overtime, but they're not getting more benefits. Or again, people are working part-time and aren't getting any benefits at all. And then some employees are really concerned about outsourcing, where their employers are sending work outside of the company, in which case those people aren't getting any benefits at all. The same with contractors. If you have people who are working in the gig economy and they're being contracted for projects, they're not earning benefits either from employers. For US firms, this can be a huge issue for international competitiveness. For example, in the US, we have employers paying for health insurance. When you go to other countries, employers don't pay health insurance in a lot of countries because they have national healthcare systems. In that case, the US companies, it can be very difficult for them to compete when they have these costs for their US employees that other countries don't have to pay for their employees in their own countries because they have these national systems. And there can also be hidden inflationary effects. If you think about how healthcare costs are going up so much faster, this makes it even harder for US employers with US employees to compete internationally because that cost has to go into the price of the services and goods those companies are selling. And then finally, our book talks about golden handcuffs being a problem for some employees. Golden handcuffs are when the employee benefits are so good at a firm or at an organization or that they're working for that they feel like they can't leave that organization because they won't find as good of benefits elsewhere. So we have to think about portability needs when employers can do that, so that employees aren't sticking around even if they don't want to be in those jobs, or quite honestly, if they're not the most competitive employees anymore, and we could get new employees that would do a better job. We don't want to keep people in that organization who maybe don't want to be there anymore.